Hi, my name is Jane Powell. Welcome to Community Connections, brought to you by the Greater Kanawha Valley Foundation. We are a show showcasing community involvement, and today I have a very interesting guest in program to talk about the future of nursing in West Virginia, and my guest is Aila Accad. Did I say that right?
Beautiful.
Okay, Aila Accad. You are the Executive Director of the Future of Nursing West Virginia Action Coalition, and a very busy day, so I can't wait to hear about your program.
Yeah, well, I love doing what I do. So,
Okay, so Future of Nursing, give us the broad view of the program, and then we'll get into the specifics.
okay. Well, it came about 5 years ago. We're 5 years old. In fact, in 2010, the Institute of Medicine came out with a report called The Future of Nursing, Creating Change and Advancing Health. And that report, along with the Affordable Care Act, prompted the AARP and Robert Wood Johnson Foundation to form a partnership, and the Campaign for Action was designed to implement the 8 recommendations from that medicine report. To do that, they created these sponsors, these coalitions in every state, and so we are the West Virginia Coalition to advance the future of nursing, to actually change the dynamic of what we think of as healthcare. We think healthcare is you get a symptom and a diagnosis and treatment.
Right.
What they realized is that that was taking us down a road that was very costly, number one, and number two, people weren't able to take charge of their own health more as effectively. So nursing, the profession of nursing, is all about helping people get and stay well. So they figured that focusing on nursing, doing more of what nursing does well, would actually help the healthcare system. And that's how we came about.
Okay, so I know with this coalition you have priority areas or goal target areas, maybe we want to say, that you focus on. And those would be practice, education, and leadership.
Correct.
So I'd like to maybe just talk a little bit about each of those and how they affect nursing, which then affects all of us.
Correct. So in terms of practice, one of the things the report, number one recommendation in the report, was allowing nurses to do what they do at the highest level of their education and training. And one of the barriers to that was that nurses, especially advanced practice nurses, who have advanced degrees and certifications and can do primary care in the community, there was a barrier there, and that was this collaborative agreement that had to be signed by a physician. Now, the physician didn't oversee the nurse's practice. It simply was one of those technicalities that had to be done. And so we got that removed, the legislature removed that a couple of years ago, which now allows those advanced practice nurses to open their own practices.
So I think this is maybe a misconception that I had and that a lot of people have, that a nurse with an advanced degree is able to open her own practice independently of a doctor.
Yes.
I love that.
Well, we could open our own practices forever, really. I started my business in 1978 with a bachelor's degree in nursing. Nursing is a completely separate profession from medicine, but because we work collaboratively and in partnership many times, people think that nurses, and because of the stereotypically male-dominated, they think nurses work under doctors. Nurses have never worked under a physician. We work collaboratively with physicians. We have different purposes in the healthcare system, and it's a partnership. It's something that works for people. It takes more than just one profession to help us stay well.
Absolutely. Absolutely. So with that, being able to open their own practice, you kind of have to guide them, a lot of them, let's say, a lot of nurses, on how to do that.
Oh, yeah. We are not, that's not part of our nursing education.
Right.
So nurses don't often think that they can be entrepreneurs. We think of business as being a separate entity. The truth of the matter is, nurses do much of the business of healthcare in hospitals or in clinics and so on. they're very familiar with cost savings and costing and how services have to run. So they run really their units, they manage people, and so on. So they have the skills, they just don't think of it that way. Mm-hmm. So this entrepreneur course that we've developed, which thankful to the Greater Kanawha Valley Foundation for supporting us in that, has actually opened the door for more nurses to now see themselves as entrepreneurs and being able to really change the health of the community.
It's also a way for the community to grow, because not only are they opening their own business, then they're hiring staff, right, and they're using equipment, and they're spending money in the community.
Absolutely. This is economic development.
Absolutely.
For sure. Mm-hmm. And that was the branch of the foundation that saw the possibility for us. And so working with Todd, we developed this grant project, and the Campaign for Action that I talked to you about, mm-hmm, and at the national level, which is a partnership between AARP and Robert Wood Johnson Foundation, they gave us an innovation grant to develop this entrepreneur project, and that, along with the Kanawha Valley Foundation grant, allowed us to start this course, and it's been great.
You mentioned Todd. Todd Orkis is a program officer who focuses on community and economic development, yes, and I'm so glad that he found your program, and you guys found each other.
We did, and it's great. I knew Todd before he came to the Kanawha Valley Foundation, and was just delighted that he was heading up that branch.
Yeah, that's great. So I think that we even have a picture maybe of your first graduating class,
yes,
from the program, which I know is something that you guys want to celebrate, and I'm sure a very big moment for all of those that graduated. Cake and everything. That's so fun.
We had 14 in the first class, and actually 3 businesses spawned from that class, and we have 5 more that are in stages of development that will create businesses.
And it is a statewide program, is that right? Okay, great. So we talked about practice. Let's talk a little bit about education.
So 3 of the recommendations of the report were for advancing nursing education. They wanted to have 80% bachelor's degree prepared nurses by 2020, double the number of doctoral prepared nurses, and we're right on target in West Virginia for both of those. And then lifelong learning was another feature of the report, and of course this entrepreneur course is part of that lifelong learning process.
So before the show started, you and I were talking that there's a shortage in nurses, not overall nurses, right, but a segment of nurses.
Right, at the bedside. Mm-hmm. So as we've advanced education, and in fact 2 of the biggest hospitals in medical centers in West Virginia require that bachelor's degree for their bedside nurses, which is fantastic, because the evidence shows that your health is better. The evidence is there for bachelor's degree prepared nurses to be getting better outcomes. So as nurses are going on for that doctorate now and becoming primary care practitioners and so on, we're having more of that. The nurses at the bedside are only staying there about 2 or 3 years, and then they're moving forward, mm-hmm, which is a good thing on one hand. On the other hand, we have to bring more nurses into the pipeline. Mm-hmm. And so that's a part of what we're working on with the coalition, is the Nursing Workforce Summit. And we have 4 action teams working from that summit to bring more students, to attract more students into nursing, to understand that nurses do a lot of different things. People have a kind of narrow view based on the hospital perspective, but nurses are everywhere.
Well, I think a good nurse can change your hospital stay.
Oh, absolutely. Yes.
Yes. Yeah. Yes, it can. Well, I'll just leave it at that.
It does,
yes.
and that's why we're very concerned. So we do want to make sure that we have highly qualified nurses at that bedside. So that's one of the shortage areas. The other shortage area is faculty. Mm-hmm. Faculty, they love what they do. They have to, because they are probably not one of the highest paid groups in nursing. In fact, you can make so much more money at the bedside. So faculty is one of the areas we want to make sure that we have enough faculty, because that's how we're going to get the bedside nurses. All the pieces have to work together.
Right. So we've talked about practice and we've talked about education. Another pillar, let's say, is leadership.
Right. So there's a National Nurses on Boards initiative, and we have one here in West Virginia to get more nurses in policy and decision-making positions on boards, and also in other kind of policy positions, because nurses bring a broader perspective. So they have this business side, but they also have this a holistic systems perspective, which is very helpful for any business that has a board. And so getting nurses on more of those policy, and particularly nonprofit and boards that are community oriented.
And so that's something that you're advocating for and working with through your membership.
And another leadership initiative we have is we give an award. We started 2 years ago, and then this year we'll do it again at our gala in September, is the 40 Under 40 Emerging Nurse Leaders Award.
Oh,
and
I love
what
that.
we're looking for are our young leaders so that we can mentor them and support them to step into these board positions and bigger positions in the community, because that's our next generation of leaders.
Because just like we talked about earlier, they've gone to school for medical training, so maybe assimilating into a board environment is a new experience for them.
Yes, many times it is. So even getting them on hospital boards as well as and healthcare boards, but also community boards, because nursing brings that broader community perspective. With the focus of nursing is the person in the context of their environment. So in the context of their community, their work, and so on. So we bring a broad perspective, which is very helpful for any board.
And I know maybe this is not an official pillar, but I see mentorship through all of this.
Yes, yes. So what we're looking at is a mentoring program for students, because we lose a lot of students. Nursing is a very tough curriculum. And so students may get into nursing, but then they fall off at some point because it's so hard. So mentoring at that level, mentoring into the leadership positions, mentoring in terms of education as well, and moving on in your education and finding the right career track. There are so many different tracks. So we have on our website, Nursing Education Toolkit, where anyone who wants to get into nursing can find all of that. They can find the different paths in nursing, different educational levels, schools of nursing, scholarships, and also, which track is good for you, which role is best for you. We actually have developed posters now with nurses. It's called Faces of West Virginia Nursing. It's in that toolkit. It's on the website, where we're taking our young nurses in different roles and making posters, and we're hoping that to get the middle school counselors to put them up in the middle schools, because that's where students decide what track they want to be on, but also that's when they decide what courses they need to take, and they need to have those math and science courses to get into nursing school.
Right.
And unfortunately, many students want to go to nursing school, but then they aren't prepared and they have to go remedial on some courses. So we want to start at the beginning and work all the way through with our students who to decide to be nurses, and then supporting them all along the way.
I love that. And I support you completely, and I'm so glad to learn more about the future of nursing. Thank you. Thank you so much for being here. Check out your website, futureofnursingwestvirginia.org. WV.org. Aila, thank you so much.
Thank you,
and
Jen.
thank you guys so much for joining us. This has been Community Connections, brought to you by the Greater Kanawha Valley Foundation. We'll see you next time.